Welcome to Human Risk, a podcast dedicated to the understanding of human behaviour as a risk. Here's your host, Christian Hunt.
Hello and welcome back to the Human Risk podcast. In this series, I speak to people who can help us better understand human risk and ways that we can go about mitigating it. As we all continue to be part of the world's largest behavioural experiment under COVID-19, we're experiencing how each of our governments are dealing, or in some cases not dealing, with the virus. I'm particularly interested in what we can learn from the way the authorities are looking to influence our behaviour to help stop the spread of this killer disease. After all, what works in this context is potentially useful in others. So I was delighted to discover that the OECD, the Organisation for Economic Cooperation and Development, has been looking into how different countries have been dealing with COVID from a regulatory perspective. They recently published a report that explores the different approaches adopted to social distancing, looking at both the rules that were put in place and the enforcement regimes used to police them. Having read the report, there's a link in the show notes, I asked one of the authors, Florentin Blanc, if he'd be interested in joining me on the podcast to talk about his findings. I'm delighted to say that he agreed, otherwise this would have been a really short episode. In our discussion, we talk about the different approaches and learn what's worked well and what hasn't worked quite so well. What Florentin had to say contained some real surprises. So as you reflect on what your country is or isn't doing well, hopefully Florentin's insights can give you an idea of where you really stand. And if you're in a role that involves influencing the behaviour of other people, perhaps you'll get some ideas for how you might think about managing your own challenges. So please enjoy my conversation with Florentin Blanc. Florentin, welcome to the Human Risk podcast.
Thank you, Christian, and it's a pleasure to be here. And thanks and greetings to everybody listening.
Thank you so much. It's fascinating stuff that you're looking into. And before we dive into your research, can you just tell my listeners a little bit about you and what you do?
Okay, so I work for the OECD, the Organization for Economic Cooperation and Development, which is an old international institution, but one which not everybody really knows about in terms of what they do. Right? What we do is primarily analyze, assess public policy and administration in governments of member countries and non-member countries, and try to look at what works less well, and make some conclusions, recommendations, assessments out of this. Before that, I used to work at the World Bank for like 15 years, I guess. And before that, I've done a few other things like working for an NGO and teaching. And my area of work is regulation, so all the rules that governments impose on primarily economic activities, but also non-for-profit. And let's say all the rules that affect the public space, so to say. In the economic sphere particularly, and specifically also how governments control and enforce these rules. And a lot of this is related to risk or to the lack of consideration for risk. So my work has been around risk-based regulation for many years, and I'm doing a bit of a parallel life between working on the practice and researching it. So I've got a bit of an academic sub-hat behind my practitioner's hat.
All of which means you are fabulously placed to help us understand a little bit more around what I refer to as the world's largest behavioural experiment, which is obviously what's happening under COVID. And you have recently published some research that's been looking at the responses that various governments have put in place and sort of measuring and seeing what is working well and what isn't. And I guess to sort of kickstart the discussion, it'd be helpful just to understand what was the scope of the research that you've done and what were you looking to discover?
So, to be honest, it's really still ongoing. To add to the context, I'm based in Italy, so we've been particularly hard hit by COVID and particularly early hit. And what we've tried to do at the OECD since March, essentially, has been to look at the regulatory responses and to what extent rules have helped or not helped to address the crisis, to what extent existing rules were more or less precisely attuned to risk, how governments try to change them, and also how they design these new rules about social distancing or physical distancing, whatever we want to call it. how they've communicated about risk, how they've enforced or tried to enforce rules. And it's really, well, it's ongoing first because the crisis itself is still ongoing, and because we're preparing a series of publications at the OECD, and we have a lot of internal peer reviews, external peer reviews, so it takes quite a bit of time, which is why in the meantime I was happy to be asked for a blog post by the regulatory review and to be able to get some of the stuff out. So there's more coming.
And so you're really, I guess, helping to answer the question, how well are governments managing this and what techniques are they using? And so I'd be interested sort of in your kind of headline thoughts, recognizing that, one, I'm not going to ask you about specific government responses because that would be unfair. But I think just sort of broadly, what have you found, and what's been, what are the key sort of discoveries you've made?
Okay. I'm happy to use some examples. I just won't pass judgment, but just a couple of examples. So maybe the first thing, the thing from which I really started this work was seeing how existing rules, existing regulations and enforcement systems were hampering the response in many cases. So in the early times of the pandemic spread in, let's say, Italy or the US, the UK, France, everybody had a lot of issues with procuring the right supplies. And I mean, it's partly still the problem, right? So having enough disinfectant for hands, having enough face masks, having enough ventilators for people in hospital. And there were also lots of problems related to testing. Approving testing protocols, that was really only a problem in the US, but still it was a major issue. And then having enough testing capacity. And I started looking into that because I noticed through a certain number of discussions, I mean, I'm on Twitter and I'm following what's happening in many countries through Twitter. And I see popping up all kinds of issues that, we can't do that because regulation so-and-so, or because rules so-and-so, because law, or whatever. Well, this is weird, why is that? And I also dug into the question of testing in Italy, which at that time was really low compared to what was needed. And I discovered that only very, very few laboratories were allowed to do COVID-related testing, even though there's a lot of capacity. I mean, Italy is a high-income country. It has had economic difficulties, but there's a lot of technical capacity. And there are certainly dozens of laboratories that could do COVID testing, and instead we had like 5 at the beginning. So my inquiry was, okay, where do we have all these rules from? Rules which were clearly designed in fair weather, right? When everything's fine. When you think that you can afford the luxury of long approval processes and long review and many bureaucratic steps, and that are completely inadequate to deal with emergency situations. And then when you look at these rules, you discover that many of them, even in fair weather, right? Even if you had all the time of your life, might not even serve any purpose. So they may be completely unrelated to risk. They're just making it more difficult to respond to risk. But they're not really helping, even if you didn't have this problem of emergency. So that was really the first finding, that a lot of the response was being hampered by legacy. Okay, so let's just take a couple of examples of these, let's say, not necessarily super relevant rules. So the US, for instance, didn't have an easy way to simply validate testing methods already adopted and approved elsewhere. So you had the WHO, which relatively quickly came up with a kit. And as far as I understood, I'm not a virologist or an epidemiologist, but a lot of the testing protocol was developed in the Charité hospital in Berlin, which is a leading infectious diseases hospital. And most countries around the world just took the Charité protocol and the WHO testing kit. That was the case in Italy. You have a government decision saying, this is what you do. Instead, the FDA went through a whole validation thing, where every testing method had to go through their full validation protocol, which requires 2 samples of a virus, which was very rare at that time. The CDC developed a completely different testing kit, which proved to not work, to give, I don't remember, false positives or false negatives, I think, but it doesn't really matter. It was not working as necessary. So the US lost I mean, and again, beyond all the politics, which were completely other problem, but through pure regulatory rules and bureaucratic steps, at least 4 weeks, I guess. Now in Italy, as I said, they adopted the testing protocols. That was not a problem. The problem that you had some old rules, and it's even difficult to find them. Same problem in France actually applied. That testing for infectious disease in an epidemic situation has to go to certain labs, the ones which are approved for such purpose. And it's not just a funding issue. I mean, Italy has a bit the same system as the UK's NHS, right? It has a single payer. Mm-hmm. So you could say, okay, they don't want to go out of the single payer network and have extra expenses by paying all kinds of fancy private labs. Fine. But even within this National Health Service, they were only using a minuscule fraction of the labs which could do the work. And they gradually added, right? I mean, each time they had to have a central decision and regional decisions to extend the list of the labs. And they did, and these labs worked very hard. So, I mean, if you look at the aggregate figures, now Italy has a high testing total. But because it has been hit so hard and because it's been working on it so long, but it has not been at all using rapidly all the spare capacity, and the same was valid in France. By contrast, we could see that Germany, one of the elements, certainly not the only one, but one of the elements of a much more successful response was that immediately all the testing capacity was online. I mean, Germany possibly has more testing capacity in total than France or Italy, but mostly it mobilized all of it, whereas France and Italy did not. And it was really purely a bureaucratic/regulatory decision.
And how much of this do you think is down to existing structures as not being fit for purpose at all, or the unusual nature of these circumstances?
I think you've got a bit of both. So I take two more examples. And usually, so another one was hand disinfection, right? So hydroalcoholic solution, as it goes in the jargon. There was a shortage practically everywhere. At the same time, manufacturing it is ridiculously simple. You can essentially do it at home. Of course, you might have impurities and you have to take care, and so it was not encouraged. But okay, so this shortage is everywhere, and I see in Italy rapidly pharmacies starting to produce their own, local chemical manufacturers starting to produce their own. And then I read all the mess that's happening in France, that nobody can sell it and manufacture it because regulations prevent it, and people keep sending back to EU regulations. You know, I mean, the UK has had Brexit, but the legion that everything bad comes from Brussels is valid. It exists pretty much everywhere. And I'm like, wait a minute. The same EU regulation on biocides is valid everywhere in Europe. So why is only France having this problem? And so it turns out you have these very complicated, layered cake, so to say, of national and European regulations covering cosmetics, pharmaceuticals, and biocides, which intersect. And the biocide regulation is made to ensure safety of the public by not having biocides that kill humans as well as germs, basically, right? And safety of medical workers and everybody who has to rely on biocides by ensuring that they are reliably effective, that the characteristics are stable. In itself, it's not a bad regulation, but even its emergency procedure takes more than months to approve a new manufacturer. So if you're going to use the biocide regulation in crisis time, you're basically dead before you have time to use it. So you need some other regulations which deal with more, let's say, low-end, trivial substances like ethanol. And it essentially fell into a bit of a regulatory crack, where the Europe-wide approval is not yet there. Anyway, it was an interesting illustration that some countries had the flexibility or other regulations which allowed them to move quickly, and France was somehow stuck, and it took a couple of weeks until the government took adopted a new regulation. And a final one I'll take on personal protection equipment, right? So the famous masks. I'm sure we'll come back to this in terms of behavioral and risk communication questions, where it's been a massive disaster with everywhere. But so the shortage was real and it was everywhere. And it turned out that most countries that are at least most of the big players in trade have quite similar standards, slightly different, but the EU, there's an EU-wide standard, and there's a US standard, and there's a Chinese standard. And they're not massively different. So most of the masks that will qualify, that will let's say, comply with one, are likely to comply with the other. But in the US, in addition of proving compliance with the standard, you also need to get a registration by the National Institute for Occupational Safety and Health. And registration of also the product and of the manufacturer. And all of this adds you know, a week or so, or a couple of weeks for each step. And these two procedures have very little to do with risk, because risk has been assessed and taken care of by the certification of the type. So these are just bureaucratic steps which don't serve very much of a purpose, but do add an additional problem. I'm not saying the entire US system is like this. I mean, this is not to say France has been generally worse or Italy has been generally a problem. All of these countries have had different problems and done some things better, some things worse. So these are just examples of, in the regulatory systems, I think we often found that there were elements which had never been properly conceived in the first place, which were there and where either the flexibility to respond to risk and to emergencies had never been built in, or there were burdens and steps and procedures which had never been really useful for risk management, and which were just there because, let's say habits. Oh yeah, we put an approval step here. Why not? Whereas other stuff, I mean, I think that the habit to restrict the laboratories was due to old approaches to epidemic control, where from a time when massive testing was not an issue, it was more, okay, let's make sure we don't have risk of contagion spreading through bad management of live samples of the virus, right? You can perfectly imagine how like a few decades ago, this was more of a concern. Now, certainly we have an epidemic of a highly contagious, but also frequently asymptomatic disease, where mass testing is needed, which had not necessarily been an issue before, right? This is a new type of risk, or a transformation in the risk. And at the same time, the average competence, equipment, and safety of most labs has gone up quite a lot. So we could simply have a list of labs that have the right qualifications, that are able to deal with this kind of samples. And it would not be every single, small lab in the country, but it would be quite a long list already. And this step had never taken place because nobody had thought, well, maybe one day we'll need to have a much larger testing capacity because of a disease that needs to be tested.
And is this, call it regulatory failure, you might be slightly politer, but I like being provocative. Is this down to also a lack of coordination between regulators? Because I could imagine that in some fields there will be several people with scope to influence. And so is the sort of balkanization of regulation an issue here?
There's an issue of coordination at all levels in the COVID story, right? It wouldn't be fair to regulators to say that it's just a balkanization of regulators. You have issues of regulatory coordination, information sharing in country, between countries, in healthcare provision and not just regulation. But yes, clearly there's been all kinds of issues related to that, and no, we've very rarely seen a coherent capacity to just review what needs to be reviewed and change it for the purpose of the healthcare response. To be honest, the countries which have done very well, let's say South Korea, did so because they reviewed all of this stuff before, because they had failed at the previous epidemic response. Right? So a lot of East Asia had the SARS and MERS crisis quite strongly, and this didn't spread so much to Europe or the US, which is why we didn't learn from them, and they learned from them. So they reviewed all these regulations, etc., but they took some years to do it. They didn't have to do it in 1 month.
Right.
And one of the things they did was creating very strong coordination indeed. So that was
interesting. And so that's the sort of infrastructure piece. So you're looking at, as you say, sanitizer and mask and sort of supply of pieces. There is clearly then also the behavioural bit, what we need the general public to do. You are trying to influence populations to behave in very different ways to the way they used to, and potentially stepping into spaces that governments, particularly in democratic societies, might not have historically been able to or be used to stepping into.
I mean, all the behavioural side is extremely important, and we're working, and we'll continue to be working more on that on the OECD side. It's really difficult because I would say structurally, in spite of the growing talk about behavioral economics, behavioral insights, nudge, etc., most governments and public administrations still haven't really come to thinking seriously about how do you influence behavior. To be honest, most of the media and the general public neither. So you still have, in my core field, which is inspections and enforcement, you still have this very widespread belief that what works is fear, right? And if you want people to comply, you need to threaten them with control and punishment, and do lots of control and lots of punishment, and then they will walk straight. And we have tons of evidence that this is not what really works, and especially not what works on the long term. The second big difficulty for governments, and I would say it's true of democratic and authoritarian governments alike, is communicating about risk. Because communicating honestly and transparently against risk implies to also communicate uncertainty. We cannot quantify correctly everything. There's some stuff we don't know. There's some stuff we cannot predict with certainty, and also communicating about your own limits, acknowledging that you're the head of government, or you're a minister, or whatever, and your power is not infinite. And somehow people who have power are usually reluctant to do that. We've got a pretty good example of but it was already far into the crisis of someone doing that reasonably well, which was Angela Merkel. I think her speech had a lot of resonance everywhere, where people in other countries were saying, can't we get that? Angela Merkel has always had a pretty down-to-earth and straightforward temperament. She's also extremely long-serving, essentially won every election for ages. So she feels particularly safe. So maybe she feels safer than others, in addition of having the inclination to say the truth, right? But she was extremely candid compared to the majority, also in acknowledging that we don't know everything, and the thing is with us for a while, and there's no silver bullet, so it would be complicated. Most governments, I think we could say, went through phases of being overconfident on all kinds of different things, on which they had no ground to be confident about, and then getting serious public opinion backlash afterwards, because they had said, either, this disease will be minor, you had no idea, so you shouldn't have said anything, right? And then continuing with stuff like, you don't need masks. That didn't turn out so well. So risk communication, which has always been a weak point, I think, of many governments, of most governments, has been clearly failing, and that's been a problem. That still is a problem.
It's very interesting when one looks at the sort of consequential pieces here, because you can take it's not as if a decision taken in the early days disappears and then you move on. There are consequences to decisions made early on that limit or at least make more challenging potentially your ability to move later on. So if I think about the UK where I am, if your narrative has been it's okay to shake hands with victims in hospital and this is a minor issue, if you suddenly want to ramp up the rhetoric and put more controls in place, that becomes very difficult. Equally, once you've put tight controls in place, unwinding those can be quite difficult. And so there's something interesting here around, it's not as if every decision can be taken fresh. You are having to sort of think about how you communicate and how you pivot from your early decision making. To that extent, therefore, early decision making does make an early approach to presentation can make quite a big difference in terms of your perceived room to move later on.
Definitely agree. I mean, I think there's still a lot of events that can turn public opinion and so reverse to some extent what you've just said. Because in Italy, initially the government Italy is a semi-federal country, so regional authorities, municipal authorities also have a lot of power. And you had a lot of confusion. You had guidelines which were not necessarily taking the local spread very seriously. You had the first lockdown, and then the lifting of the lockdown for Milan, which turned out to be a disaster. And nonetheless, I would say, people have not only complied quite well with lockdown, but even post-lockdown, I think the level of overall compliance with safety guidelines is not so bad. There's certainly not enough efforts to explain how to do things right. So you see lots of not necessarily optimal mask wearing, etc. But people are serious. And why? Because they saw firsthand the damage and got really scared. I don't know. Well, in some countries it doesn't seem to work. I mean, we seem to have very high fatality rates in the UK and in Sweden, and it doesn't seem to really resonate that much. But definitely in Italy, that was the case. Seeing the richest part of Italy, in Lombardy, which is essentially one of the, I think, 5 or 6 richest and most economically powerful regions of Europe, not just of Italy, being completely devastated, has really, really made people, quite, to say in German, nüchtern, has of people when you see that. And it hasn't turned out this way in every country. I recognize that. So there's lots of dynamics at hand. Maybe what also played in Italy was that after that, every politician pretty much went quite serious, right? So there's a combination of how you act and how events proceed. But all things being equal, right? Which they're not. But I mean, if they were all equal, surely having your government communication more consistent and not overconfident, right? When you're not sure, you say, "We're not sure. It could get worse. It could prove to be insufficient, etc." Seems like a good idea if you want to keep public confidence and to have more legitimacy for future action.
Right. And I was fascinated by a piece in the research where you talked about the differences in compliance between on social distancing measures between Southern European and Northern European countries. And the conclusion you reached was that the sort of prevailing cultural stereotypes about European countries' regulatory compliance are I think the phrase you used was generally fallacious. In other words, this isn't responding, and the people aren't responding in the way you'd expect them to. And I think that's really interesting.
I think, yes, I phrased it this way because we have a lot of evidence in different fields that this stereotype is anyway not true. As someone who's been working in, I think, more than 40 countries on 5 continents, I haven't seen any obvious, clear evidence that there are so many countries which are structurally more compliant than others. There may be, but it's often historically changing. So it's not like a permanent thing. It's more something that is evolving, and people can be very compliant in one area because it aligns with their prevailing cultural norms and not in another. I think this is much more the reality of what you'll see. So this blanket thing about, Southerners not obeying the rules versus Northerners obeying them, which is a stereotype that even people in Italy or Greece tend to believe, right? It's not just a Northern versus Southern stereotype. It's like the prevailing stereotype. It's probably bullshit anyways. And what is true, on the other hand, is, as somebody who's been working on regulation and administration for many years in these countries, is that Southern Europe has a lot of extremely rigid procedural bureaucratic norms which make life very complex, and where essentially you cannot work if you really abide by all of them. So you have more opportunities of violating rules because there are so many rules, right? So it may, if you were counting the number of rules violations, well, if you have 10 times more rules or they are 10 times more unreasonable, you're going to have 10 times more violations. it doesn't really mean that your population is intrinsically less inclined to obey rules, particularly when these are rules which are, say, essentially sensible, right? So that's one. I mean, we're still working on that, and we're going to continue working on that for many months at least, because there's data coming from mobility, app tracking data from Apple and Google, where you can see how much people are moving. In countries like France or Italy, who do controls on people, were doing at least during the lockdown, you have data from the police. But in any case, what we've seen is very high compliance rates in Italy, definitely, both in terms of what the police recorded during their checks. Actually, like the non-compliance was less than 5% at pretty much any given time. And the decrease in mobility as measured by Google and Apple was particularly strong. So lockdown measures largely worked in Italy. And interestingly, they largely work, I mean, in terms of compliance and in terms of the decrease of the epidemic itself, they also worked, but less fast, clearly. And there you have a lot of factors that play a role, and the epidemiology of the disease is still imperfectly understood, let's say. So this is all a very complex story, but yeah, it definitely puts the light to the stereotype. And I think anecdotally, what you're seeing in the UK right now versus what you're seeing in Italy right now in terms of general behavior, that's the same. Right? There's probably more caution around in Rome than what you see in London. That's
right, and it's, I mean, it's, what I find amazing is that statistic you quoted about the level of non-compliance is astonishingly low, given the nature of what people were being asked to do. Because this isn't a sort of a small incursion into people's civil liberties. This is a massive ask that requires people to fundamentally change the way that they behave, to make financial sacrifices, to make social and personal sacrifices. And so this isn't a sort of small thing, this is a huge thing. And yet these massive rates of compliance have, broadly speaking, been achieved. Mm-hmm. Do you have a sense, because that is that largely driven by just personal perception of the risk? Or is there something clever in the way things were communicated to people?
So one thing we want to do, and we haven't yet gotten to it because the French have not published the data as regularly and as transparently as the Italians on their own control. One idea was to control France and Italy, which had somewhat similar systems, but apparently, at least anecdotally, seemed like more heavy-handed enforcement in France, which didn't seem to bring any significant improvement in compliance. So it didn't seem to be the harshness of enforcement that was bringing it. But you cannot. There's no counterfactual on no enforcement either, at least in Southern Europe. There are some in Northern Europe. So maybe no enforcement whatsoever was not necessarily optimal. I wouldn't say communication was always great in Italy, at least in terms of, it has not necessarily been great in terms of the safety measures post-lockdown, right? It's not detailed enough, it's not hands-on enough, but I think really people, through a variety of things, got the idea of a very strong, even personal risk. Again, I tend to have more difficulty understanding why so many people in Northern Europe don't get it. I've had, for me, slightly surreal conversations with colleagues and friends in anywhere from the Netherlands to Ireland, and it seems like, I mean, when you see the fatality rates, they can be quite serious. I mean, in the Netherlands, they were definitely much less than in Italy, but still significant. And in the UK, they are higher than in Italy. And somehow it seems people react differently. I don't know whether it's a question of how the media is covering it. I mean, we have a lot that we don't know here. We just can definitely see that maybe there's a mix of how the government communicated, how the media covered it, and the clarity of the rules maybe did play a role. Maybe being very directive and saying, this is how it is. it's hard to exactly say, but he didn't play by the stereotypes clearly.
You were driving exactly where I was thinking about this thing, because it's obviously the thing people want to understand is what is it that one can use to influence what works and what doesn't. And clearly it's not a case simply of potentially sort of North Korean style, one might say, of just issuing instructions and the only message you get comes from your government. You are picking up all sorts of information, be it from traditional media, from social media, from your own perceptions. And so there's a host of influence in the people. And it sort of struck me that this is one of the challenges we've got, is that it's not a case of governments operating in a vacuum and able to influence things. They are competing with or potentially working alongside, depending on whether there's this sort of conformative message, a whole host of other influences. And so I think that's a really interesting question. And it also strikes me that if you look at lockdown versus lightening up, lockdown is pretty simple because it's a straightforward, this is what you need to do, and we'll put some control. When you start to remove some of those things, either because you formally announce it or because people perceive that it's okay to do that, so the behavioural contagion piece that we're seeing, I think, in the UK, it's a lot more complex.
Yes, I think that's clearly true. I mean, it's been easier in a way to impose a lockdown than to do things which are a bit in the middle. And we don't know yet how things will turn out in Italy or in France or in Spain in the next weeks. Although, Italy has now been nearly a month since it started to gradually lift the lockdown, and we don't see things at least going out of control. So that's encouraging. There's certainly a lot of the sub-state communication and non-state communication which matters. Because structurally, and I work a lot on the question of government trust, confidence in public administration, etc., which is a very complicated topic. So working a lot on it doesn't mean you have lots of answers. You probably have more like lots of questions. At least you can usually say that there are a few things you shouldn't be doing. It's more difficult to say what you should be doing. But Italy traditionally has problems with low trust, and France has been going through a really difficult more than decade of declining trust. And traditionally, you would say the UK has much higher trust in government and authorities, and we're seeing kind of a bit of a reversal. Now, maybe it's just because, in spite of the backs and forths on masks, which has been a big mess, the communication has been more consistent in terms of what to do in France and Italy, and maybe people have been scared more. It's really hard. I mean, I'm repeating myself by saying we don't very much know yet. Maybe we will never fully know. There's lots of things we're asking ourselves about. But clearly we see different levels of taking things seriously or not. And that's interesting.
Right. And one of the things, obviously, that drives people's compliance rates is their ability to comply. And a key piece around that, obviously, being particularly where you're being stuck at home has an impact on your income. Either because you can't go to work or because your business is unable to function in the current environment. And so there's been various moves by governments to try and deal with that, to kind of, if you like, remove the impediment that people might otherwise have for not complying, or for complying rather.
Yeah.
And I'm interested in what you found in terms of sort of things like sick leave, income compensation, those sorts of things. How much of a difference that made?
Okay, no, that's super important. I really like the way you phrased it at the beginning, which is how I always also speak about this. It's like if you're not going to comply if you physically cannot, right? If you're going to die, you're probably not going to comply.
Right.
This is a bit of another part of OECD working more intensely of this stuff, because we have the economics department, people working on social systems, etc. But still, obviously, in my division on regulatory policy, we also look a bit at this stuff. I think here you see the big divide with the US, right? Where this is a massive problem, and where it's been much more difficult for many people, to just shelter in place because they essentially will starve. And this is a big problem with the absence of sick leave in most of the US and the absence of universal medical coverage, because then people have problems getting their COVID-related treatment tested, COVID-related treatment covered, or the testing covered, or if they're sick, they're still going to show up at work because otherwise they will be fired or not paid. I would say here the difference between European countries within Europe and even including Britain in spite of the Brexit is much lower. I mean, most countries have relatively not similar, very differently organized, but in end effect, right? Somewhat similar safety net. Still, there are differences in the level of the safety net, and I think there are also big differences in the coping mechanisms. So you could say, again, if I take Italy, and we'll see all of that later when there's time to analyze things more complex, more globally. But Italy has been in economic/social difficulties, if not crisis, for at least 20 years. It's not going super well. And nonetheless, people have complied quite strongly. Now, the government safety net was not particularly outstanding compared to other places. It was not the worst, but it was, as usual, in Italy, a bit bureaucratic, so a bit difficult. I mean, once you get the money, it's not too bad, but sometimes it's a bit difficult to get there. But people have a lot of informal coping mechanisms. So you have high home ownership, high family ties and family networks, and somehow people manage to make do. So maybe a different way of living where people are more used to just not go out and not necessarily do this or that. I mean, again, I'm doing some offhand pseudo-sociology, and I don't like doing that. I do think that this has also had an impact, that it's relatively easier to cope with that kind of things if you have a lot of informal or traditional coping mechanisms in terms of both of lifestyle and income. If you own all your, if you don't have debt, etc., and you can essentially, just eat restrain a lot your living costs, versus a more quote unquote modern society with less of these coping mechanisms. People are more exposed to costs like monthly rent, right? And where they can all become much more difficult.
And that's very interesting, because it's sort of all of this stuff. If I try and pull a thread between it sort of says that in many respects, modern society is not set up to handle this piece, and that's from a physical infrastructure capacity, which is around just-in-time supply chains and reducing redundancy and sort of having a world of relatively heavy regulation, through to some of the more sort of social economic trends that impact the human behavior on the ground. And all of those things you're pointing to, and clearly I'm summarizing broadly here, but there is something around modern ways of doing things don't seem to make us resilient in the face of something of this kind.
Yes, I'd be a bit more nuanced on the modern versus non-modern, because definitely there's a bit of both, right? I think it all depends how your quote-unquote modernity is set up. I think we've seen Denmark or New Zealand or Germany, to take a more massive country, do between reasonably well and very well. And that involved, let's say in Germany or Switzerland have done, in terms of income support, have managed to do it in a way which is very rapid, much lower level of bureaucracy in terms of getting the state aid. And that's linked then backwards to legal systems being less, about assuming everybody is guilty, and rather assuming that people are honest. And the Italian system, unfortunately, has been increasingly, let's say, defensive, all in the name of anti-corruption. So anti-corruption can get you in a very wrong direction. And you probably know that, having worked on compliance, right? It can take you towards, defense, right, which has no real purpose, but where you can say, "Oh, I've done everything right." So banks are in Italy right now are very reluctant to give out the loans, the aided, the super facilitated loans, because if they do anything wrong, they may be taken to court later and lose. And lose big and lose criminal cases, and they're not very happy with that. So there's a lot of things, and this is not modernity, right? This problem doesn't come from the Italian system being quote unquote more modern. That's not really the thing. So again, like countries like Denmark, Germany, or Switzerland, which have been quicker or more flexible with that, or which have very good social safety nets in general, have been doing better. I think what there's not any country on the planet that ticks all the boxes ex ante, right? And again, so the fact that some countries have done super great in East Asia is probably a factor of them having had some epidemics in the past. And then there's the mystery countries where we cannot make sense of the data. So I'm just not, we're waiting to understand because we don't know. But in South Korea, we can make sense of the data. So they had an outbreak, they responded super well to it and wiped it out. This is understandable. We know how they measure, and we know that they really measure. Right? They're not hiding the cases somewhere. So I think if we want to make systems more resilient, right, maybe taking it the other way around, we first, I would say, we need the social and income support systems to be much less distrust-oriented and much more trust-based. Basically give the money faster and checking less, because even if there's like a couple of % of abuse, that's going to cost you infinitely less than delaying payments and putting people in poverty or in harm's way because they're not going to comply because they need to eat. Right? Reviewing your rules, your regulations to make them less cumbersome. Taking out the barriers where they don't really serve a purpose, right? Having a risk-based perspective in reviewing your regulations and your procedures. Or being better at communicating, including at communicating uncertainty. And indeed, in terms of foresight, right? You cannot forecast every possible risk because by definition some are really unknown. And so working on alert systems, I think what the crisis has shown is we have potentially lots of data, sources of data, capacity to analyze data, etc. We make very little use of it. So the response has been often very slow. And sometimes it was politics and politicians refusing actively to see things. And that's unfortunately, that's something we can't do much against. But often it was really that the signals were not seen early enough because the data systems are not sufficiently interconnected or not sufficiently automated. So there's a lot of work to do here where modernity can help, right? If you can detect that there's a cluster of cases of you don't know what, but where people seem to be sick in unusual ways, which is essentially what was happening in Lombardy. And you immediately have your analytics sending you an alert that this is not normal. Then you can react much faster. And sometimes it's to mix with, you could make an automated monitoring of chat rooms on the Chinese social media. It's essentially what Taiwan was doing, right? And that's how they reacted before China even said that there was a problem. They just saw that the chat rooms were speaking about the virus in Wuhan. And were like, that sounds bad. So they reacted late December when officially there was no problem.
Yeah, and that's interesting, right? Because it's sort of, if you wait for the evidence, you will have missed the opportunity to act.
Yes. In this crisis, we have both, right? We have the countries that would say Italy was the first country in Europe to be massively infected. And it was far too slow to react to small fragmented evidence, which if it had been taken together would have yielded results. And there was no system to do that. So that's the example I was giving. But of course, we also have a lot of the rest of Europe, which was simply looking at Italy and thinking, it's Italy, right? That's where prejudices can really kill you. There's this prejudice that, Southern Europe is less developed or whatever, they are less competent, and if it's so bad, it's because they're Southern Europe. And we've seen in the meantime that this is not the way people should think.
Right, because it was astonishing sitting here in the UK, because there were literally people in Italy sending messages to the UK. And I remember watching these things going, it is coming your way. this is what we've been doing, get ready. And I remember watching those things, and it was very clear that advice was not being heeded in any way, shape, or form, or at least not meaningfully.
I think the UK was far from unique, unfortunately, right? I mean, it's based on the current figures, it's done particularly not super well, for a variety of reasons again. And again, it's difficult to speak with provisional numbers. But essentially, the big element in how well countries have done has been how fast they've reacted. And people have been quite unhappy in France that the government didn't react earlier. And it's a bit of a glass half full. I mean, objectively, they're right. But they're also a bit wrong if we compare with some other countries. The French reacted just a couple of weeks, 10 days after Italy. Not so bad. The result has still been bad, but not as horrible as it could have been, I guess. So, the incapacity to learn from what's happening elsewhere is a bit what worries me for the future. So I think part of it can be improved with systems, right? I mean, data analytics and so on. But part of it has to be a change in the mindset and the understanding that, if things are going abominably wrong in another country, not very far from you, maybe it's not a good idea to just think that you're so much better.
Right. Which I guess is part of the purpose of the research, right? Which is to highlight some of these things and almost, you provide a very convenient framework and banner under which people can look at it. So we don't have to say that we're copying the Italians or copying the French or whatever. We could say that we're just following OECD advice. So you are sitting very nicely in a position where, assuming people are willing to allow sort of supranational organizations to influence them, which of course some jurisdictions seem less keen on, there is something quite powerful in what you're doing.
Thanks. I mean, that's supposed to be what we're here for, and because it's not yet ripe to be an official OECD guidance, we have our management is smart enough to let us publish these things a bit as it's a blog post. It's not an official OECD conclusion because we need to work harder for that. I mean, I have 16 pages of comments on my longer version of paper to address this week. But that's what we're trying to do, at least to find some of the better examples, and there are a bit of them everywhere, and some of the things which you shouldn't do, and again, there are some of them everywhere. So it's not about singling out a country or another. It's trying to see all the good and all the bad things we can learn from all around the world and try to improve slightly at this next time.
A final question, as we look at this, and the word unprecedented is being used an unprecedented number of times. So I'm going to try and avoid using it, although clearly I have twice now. But there are a lot of things where I think there's an attitude that sort of said this will pass. And so we put in place temporary measures to be able to deal with that on the basis that we can return to I think a lot of people delusionally saying normality, but that we can return to something approaching normality. And so there's a sense here that we need to step in and do emergency things. And whether that's an emergency, cutting back of bureaucracy and regulation, whether that's an emergency injections of economic support. What sort of have you been seeing in terms of how people have been handling that, and what's good and bad practice for things that one might not be willing or able to do on a longer term, but might need to do on a shorter term? How can we think about that piece of it?
I mean, so far, I haven't been an awful lot of forward thinking. I mean, you can see a lot of think pieces right here and there, but I think most governments and public administrations are really still stuck with dealing with the immediate crisis and immediate aftermath. I know that there are some research institutions, some internal think tanks or committees, etc., in different countries that are trying to think, further. But we're still at the very early stages. We know very little about this particular disease. There's a lot of epidemiologists whom I've read are worried and think that this disease could be with us for a long time, and I would say even if this one isn't we are likely to have others, right? I'm sorry to say it like this. Right. So we need definitely to look a bit harder at a number of things, right? Risk analysis, risk response, risk communication, resilience, and support mechanisms, which should be ready to be rolled out, right? I mean, everything in a way that Korea or Taiwan learned from the SARS and MERS crisis and developed. And it also shows that it's not impossible, right? It may be more or less difficult to do certain things, but there are lessons to learn, which is also why we were encouraged to work on it, because we thought, well, okay, maybe given all the delays of doing this stuff and reviewing it and publishing it, some of the parts of the crisis will be past once we publish it. But there's always going to be a need to learn from it, to try to make it, to manage the next one, either a second wave or a persistence or the next disease or the next we don't know what, right?
Right. Fascinating stuff. Look, firstly, thank you for doing the work. I know it's your job, but nonetheless, it's great to know in a world where I think we're all sort of feeling more reliant on people to take care of us and to be thinking about these things. It's nice to know that there are people out there looking at this and seeing what we can learn. So I'm delighted that you're doing this work. Thank you also for sharing it in the way that you have. And above all, thank you for coming on to the podcast and talking about it. It's been incredibly interesting. And I think this isn't just something that applies to governments. I think this also applies to other organizations and the way that they think about their own resilience and responses to it. And so I think there are lessons across the piece. And so from a human risk perspective, this has been absolutely fascinating.
Thanks a lot. It was a pleasure. It was a great conversation, and it was great to hear your insights and questions. So we stay in touch, and thanks for everybody who's been listening.
Excellent. Well, thank you so much, Florentin, and above all, stay safe.
Thank you. Same to you.
That brings us to the end of another episode of the Human Risk Podcast. My huge thanks to Florentin for appearing on the show and to you for listening. If you're new to the Human Risk Podcast and aren't already subscribed, you'll find it wherever you get your quality audio content. Just search for Human Risk Podcast. While you're there, if you could leave a review on the platform you use, that helps keep the profile of the show up, allows me to continue to attract the kind of high quality guests I've managed so far, and also allows other people to find it. I'll see you very soon for another episode of this podcast. I'm putting them out far more frequently than I would do normally. So all that remains for me to say is stay safe, look after each other, and thanks again for listening.